Can you describe the process of getting diagnosed with EDS?
My process was a very long one. I knew around 20 something that there was something wrong. There wasn't a lot of information, so I was always taken to the hospital or the doctors because I was clumsy. I had a lot of falls. I had a lot of sprains. I had a lot of twisted knees and ankles and that kind of stuff. So I was just really considered a klutz, and after puberty, unbeknownst, I had PCOS, which is a common comorbidity of Ehlers-Danlos for those with uterines. And I gained a lot of weight, which is typical with EDS. As the medical industry is very typical, if they don't think of hoof prints being of a zebra and not of a horse. And so because I was dubbed as klutzy, and I was overweight, then it was, it was all focused on my weight. So when I was 27, I was diagnosed with PCOS, finally, and I was at my heaviest at that point. Once I got that under control, I was able to start losing weight. And eventually it came to, look, there's something wrong. I've dropped over 200 pounds. There's no way, there's no way it's my weight still. What's wrong? And I finally got a doctor to take me serious, because up here in Maine, they're not very knowledgeable of this kind of stuff.
Yeah.
So she started taking all kinds of tests, for lupus, for Lyme disease, for fibromyalgia, all of that kind of stuff, and wasn't sure what was going on. So we were just looking into all kinds of different things. At this time, I had started doing a lot of research myself because I knew that there was something. And it took me many, many years to try to figure it out. I found out about EDS, I believe, in 2019 or 2018, somewhere around there. And I started just getting all kinds of information and really putting all of this, a binder of information together, because a lot of us zebras, we need to have a huge binder, to take with us. And so I was going through, and I had gotten a hold of people that had, EDS. They sent me over to a website that was in UK, and that's the Ehlers-Danlos, society, originating in the UK. And they had some nice criterias. They had a actual medical criteria that you could fill out, and generally your doctor would fill it out and, do that. Had done genetic testing before she would even look at that. My doctor didn't want to, and she was a nurse practitioner, not even a doctor. But she didn't want to look at it, so she was like, well, genetic testing, of course, that's quite expensive. So my father was able to help me to pay for the genetic testing, and there is no actual marker known right now. They're kind of in the background. They're testing a few theories, but it hasn't been released yet. But I had some definite markers in my collagen. Thankfully, nothing that went with any of the other ones. I do have a lot of overlapping that can also come from another disorder that I have as well. But I break my blood vessels a lot. I have a lot of the vascular stuff, as well as I have a very similar face structure for classical EDS. I had to give genetic testing, and then after that, I finally just kind of had to shove the thing in her face and say, look, I'm hitting all of the scores and then some. And so finally in 2001, or 2000, I was finally diagnosed at 43 years old or 42 years old.
Of which classification were you diagnosed with?
Yeah, I am diagnosed with hypermobile EDS. I do have a lot of signs. I do have the facial structure of classical EDS, and I have a lot of the symptoms of vascular EDS. I have pretty see-through skin, so you can like really actually see my veins really well through my skin. It's
Yeah.
it's pretty crazy. It's I'm allergic to pretty much everything, which is also another one of classical EDS. So yeah, they're still learning more. So there actually might be I have a when I did the genetic testing, I had two variants that showed up that they're really not sure what they mean, but I believe they, could probably be something to do with the EDS as well.
You may have touched on this, but what were the initial symptoms that led you to seek the medical advice?
Everyone kept telling me that I wasn't active enough, and that the biggest thing was the klutz, the klutz.
Uh,
I I knew I wasn't just spraining my ankles, which are my weakest joint. And yeah, just I'm like, this isn't right, there isn't. And so I was like, frequent another reason for frequently spraining ankles. And that kind of led me to connective tissue disorders. And
yeah.
then I started hearing about all the comorbidities of the different things, and EDS just really, really kind of hit with me.
The next show is going to be how long did it take to get a diagnosis after you first noticed the symptoms?
Oh yeah,
So,
22 years.
how does EDS affect your daily life, like just day to day stuff?
Well, this one's kind of a really hard thing, and unfortunately, it really honestly took me being down to my lowest. I blew my knee out at my job. I was going up and down 3 flights of stairs countless times a day. I had already been in physical therapy to like help with my pain. I had already I'd started going to mental health things, because still for a while it was, your pain is because you're depressed. Your pain is because you're
Yeah.
depressed. I'm depressed because I don't and I will unfortunately never have the life I used to live. I've currently been out of work for 3.5 years. I have lost a lot of my abilities to take care of myself. I had to shave my head because not only was it hard to take care of, even just to my shoulders, it was falling out because of all the medications that I'm
Mm.
on because of the mental health and the other health. And right now in July, I will finally be going to court to battle for my SSI, which now is pretty guaranteed because it's to the point now that I live in a separate home from my partner and his family, his children, because of another mental health issue where it's not safe for me. So it's removed me from my home. It has caused me so much anxiety and stress and depression that after 22 years of working in the mental health field, I now have multiple mental health diagnoses, and I have my own staff that comes in and helps me. And now I have been approved for medical staff called palatable care. And so I now will have someone to come in and help put my TED hose on, because arthritis has excessive joints wear and tear. Arthritis has taken, most of the use of my hands now. Unfortunately, a lot of people, especially, presenting like I do, it takes forever. and unfortunately your body wears too quickly, especially when you have, a bit of a pride issue, ego issue, whatever, that you're
Yeah.
like, I might be
No, you don't
chunky.
have that.
I might be chunky, but I can run circles around you. And,
Yeah.
look at this. I can do all these Spidey poses that most people can't, and, definitely not something that's good. So, yeah.
What treatment options or management strategies have you found the most effective?
Really, the biggest thing is listening to your body. It's the best and the hardest thing. I had to really start doing that during my learning process and during my investigation, that, what works for me, what doesn't. I can do a lot of different things, but a lot of times it has to be in moderation. If you work yourself too hard, things will dislocate. Our muscles are the things that are actually holding us together, not our joints and ligaments. So you'll get ligament tears and strains and sprains, and your muscles
Mhm.
will go so tight that you have to take muscle relaxers to just be able to move. I get spasms a lot, tremors, different things like that. So it really, honestly, the best treatment, prevention, the best thing you can do is learn your body and know how different things, how different temperatures, different foods, affect your body. I have had limited success, unfortunately, with physical therapy. In the beginning times, physical therapy is good. If you have weak joints, get some bracing on there. Talk to your doctor, and, have them write you a script for that, or send you to, the people that can do that. Because if I had been able to stabilize my joints earlier, a lot of the wear wouldn't happen. And, just advocate for yourself, because nobody else is going to advocate for you. Keep your information, you know, keep your proof, and never stop.
What kind of support system do you have in place, such as family and friends or other support groups?
So right now I have my partner who takes care of me for the most part. I have daily living skills staffing that comes in twice a week to help me get out into the community, to talk about my mental health, how things have been going, different things like that. She helps with some chores. They don't do a lot of actual chore stuff. They, ask me about my medications, if I have enough refills. They get me out into the community, because sometimes I can't drive.
Yeah.
Right now, I will have home health care staff, and they will help me with dressing, making sure, because I'm considered a fall risk. They will be making sure that I'm not, falling in the shower, and can help me, because unfortunately we don't have a lot of those kinds of supports in our area. Thankfully enough for me, that they will hire your family. So my spawn is going to be helping me. And so I'm really grateful that they're willing to do that, to do all the certifications and stuff. But yeah, I have a pretty good support system. I have a therapist that I see regularly, med management. Unfortunately, I don't have pain management available to me. A lot of times with EDS, pain management involves different types of injections. I am 100% allergic to every single one. I had to go and have an allergy test, and I'm allergic to everything that they can give me for pain management. So, unfortunately, I just have to kind of deal with the consequences until I can't walk, because I have arthritis everywhere. All of my joints have degenerated. But because I'm such a young age and I shouldn't have the body of a 90-year-old, they just see the age and they're like, you're too young, because we'd have to replace it. A lot of times, EDS patients don't have the normal lifespan of most people. So, It's kind of a catch-22.
Are there any resources or organization that you find particularly helpful? You had mentioned you initially started and ended up at a website through the UK.
It's the Ehlers-Danlos Society, and they are based out of the UK. They have wonderful resources on their site. There are a lot of different, like with the comorbidities, where you have different things that go with it. You can have POTS, which is posterior orthostatic
Yeah.
tachycardia syndrome, which I do have as well, which has its own special, things that you need to look out for and stuff. And so that's why I was able to go, well, this is why they can't figure anything out, because nothing points to one thing.
Yeah.
And when it doesn't, that's typically there. I know that there's a main center down in Birmingham, Alabama. It's like a specialty place, a hospital and different offices, because it's not really your doctor you're ever going to see. It's all the different specialists to, to
Yeah.
to do the different body parts that need to be taken care of with EDS. Yeah, I really just that website and then Facebook groups have really just been the greatest thing. And as of late, TikTok has been amazing. I've been kind of been saying I need to start doing. I've been saying that I'm gonna, be more honest about everything going on. I just haven't gotten over that stage fright, that anxiety, nervousness a little bit, but I am.
Still a young.
I'm very much fighting because my child is 21, just turned
Yeah.
21 as well, and dealing with a lot of the same things. So I really keep trying to fight with her to get
Yeah.
into the doctor soon, get the things you need so that way you don't hurt yourself and you can live the life you want to.
Would you like to share any specific experiences of how EDS has impacted your relationships?
Oh, so I
Going deep now.
we're going deep. Um it's a genetic disorder, which means, shortly after conception and the cells began to form. We do know that collagen has everything. It has really affected me in the way that it caused a couple of mental illnesses. I have been, as typical with a lot of people with Ehlers-Danlos or hypermobility conditions in general. I have the wonderful trio of ADHD. I do not have autism, although I have autistic tendencies.
Yeah.
Basically, it did a lot with my brain. At a very young age, I had a TBI, and then shortly after that, I began having epileptic seizures. I was also born, with my feet turned in, which is another classical thing that comes up. And my 80s baby, you're gonna cry. I'm gonna give you something to cry about. You hurt
Yeah.
yourself, well, go dust it off and go play,
Yeah.
or rub some dirt in it and it'll be all
Yeah.
right. Yeah, it really, at a very young age, with my brain not really understanding normal interactions anyway, from a young age, I really wasn't taught a lot of things. A lot of life's things weren't explained to me. A lot of the things that were in my life were not really all that great. And so right from the beginning, my relationships were never normal. And I mean, that's like the deep, deep part of it. With my partner, our goal was, to be fully sustainable. We live on a nature driven homestead. Right now, it's kind of all up to him, because I can't do the physical things. I can't stand up to do the dishes. My fingers dislocate when I do the dishes. I break blood vessels in my hands. I have my spine is kind of crushing down on itself. There's never a second that I'm not in pain. So we don't get a lot of time together. We're not able to do the things that we had planned for our lives. It makes it difficult when, hiking is something I used to love to do and we used to love to do together. Foraging, gardening, processing food, standing there for hours blanching or, canning, those kinds of things. I can't open cans myself anymore. So there's a lot that now it's kind of turned over to worrying whether your partner thinks or feels that they're now your caregiver rather than your
Yeah.
partner, when there aren't a lot of things that can be done together like that. And of course, eh, all honesty out there, physical intimacy becomes a big issue when everything dislocates, when, certain things can cause your skin to rip apart, because of the frailty of it. So it really does, especially in such advanced, and I do have a little bit more of an advanced case than is typical. It's definitely, it changes your whole life, your whole life, even your relationship with yourself, because there are some times that I don't even see myself as a person anymore. I see myself as a patient, as a number that, okay, now I've got to go here. Now I have to go there. Today's this appointment, tomorrow's that appointment. And
Yeah.
you get lost. You lose yourself pretty quickly. So
Oh
yeah,
man.
it
Well,
changes your whole life. Guys like I'm short. Guys like to pick you up, when
yeah.
you're short. My partner tried to do that, just nice and lovingly, not, anything, and I dislocated two of my ribs and my sternum.
Oh, yeah. That's
Um
yeah.
yeah, a lot of people are like, "No, I don't really.
I'm
You're too
good.
fragile. You're too fragile." No. So, yeah, it makes it very hard. EDS also took my teeth. I
Yeah.
I have beautiful teeth now, but I have dentures, and that's another thing too that kind of, with the partner and meeting new people, how do you tell them, "Oh, yeah, well, I can't eat that because, my teeth would fall out."
Yeah.
Yeah.
What do you wish more people understood about EDS?
EDS and honestly, invisible illnesses are really
Perfect
the
term.
big, invisible and chronic. I get so many glances because I do look so young, which is a typical trait of EDS as well. So, our flawless faces, you tend to get a lot of looks from older people and younger people. I walk with a cane, and they can't tell all the braces that I have underneath my clothing. And, my good days, sometimes I don't really need my cane, but most of the time I do. And just dealing with an illness that no one can see 90% of the time means also you've had to fight your whole way before even getting a diagnosis, if you can even get a diagnosis. You know, I just wish more people would be patient with everyone, but especially, with these invisible illnesses, because it's hard existing already. And, we want to do what we can do because we never know when we're not going to be able to anymore. And we want to live our lives too. We want to still be as active as we can. And it's better for us to be as active as we can. But a lot of times we just need a little bit of patience. The ADHD hits differently, because you're trying to walk somewhere, and not only do you have ADHD, you have pain fog.
Yeah.
So your brain's not, you're sitting there going, "What did I just come in here for?" Or literally within 2 seconds, I can forget what I was looking for because I saw something else. And um,
Squirrel.
exactly, exactly. Just be patient with us. Try to be a little more understanding and know that, not everybody goes through things the same way. Just because something looks like something doesn't mean it's not something else. All around. I mean, yeah. We all just need to be nicer to each other, period.
Have you been involved in any advocacy or awareness raising activities for EDS?
I have. I am very there's a charity group that is down in Florida, and it is called Sophia's Helping Hands, and it is a amazing young woman, and her mother started this group. I think it's a 501c. They help to bring more knowledge, more awareness. They really focus on children with EDS, and all the different varieties. They do little med packs for people that are coming out of surgeries. They do walkathons and all kinds of different promotions, which I had found them through Facebook. And in a collaboration at one point, before I was unable to really do a lot with my hands, I had donated a bunch of pens, like writing pens. I made them out of a regular pen and epoxy resin. And I made, zebra pens because they were putting together, I think it was New Year's little bags or whatever. So when people go to the hospital, they have things that they need. They have a pen to write things down. They have a little calendar. The kids would have like a plushie or something like that.
Briefly, uh, explain zebra.
So zebra, of course, as many of us, we do call ourselves zebras. There was an old saying in medical terminology, medical history, if you hear hoof prints, it's a horse, that's generally how it's thought. But unfortunately with Ehlers-Danlos syndrome, it looks like this, it talks like this, presents like this, but it's not. Even though you're hearing hoof prints, zebras make hoof prints too. And so it was coined, I don't remember, I want to say it was like 60s or 70s or something like that. That it was coined, when you hear hoof prints, don't automatically think of a horse. And so the zebra has been our spirit animal for years and years. It has been such a strong thing for a lot of us. It's we're zebra strong, we're herd, we're resilient. We're not as monochromatic as we look. We have so much more to us than just that. And a lot of us now, I have so many things that are zebra related, because it really has become a sense of pride and a sense of, after so many years of not being believed, thought to be crazy, you're just too emotional, you're too large, you're klutzy, you're this, you're that. No, we are zebras. We belong, we exist, and we deserve to be taken care of and taken seriously.
What advice would you give someone who has just been diagnosed with EDS?
I would say hallelujah. Be very thankful. It's very hard. And if you have fought and are now diagnosed with it, I'm proud of you for continuing to fight through, because that's very hard a lot of times in the process. Do what you can, take care of your joints. The party tricks are cool. You may think that, people will like you better if they know you can, contort yourself into any position and whatnot. Don't do it. Don't do it. It's gonna hurt in the long run. And I would honestly look into your eating habits as well. I follow a fairly strict anti-inflammatory diet, because that is something that's very common. Inflammation throughout your entire body, inflammation in your gut, gastroparesis is common. Just really look into the things that are good for your body and good for your joints. Stay active as long as you can without overdoing it, and take the rest when you need it, because you don't start off with as many spoons. You don't have as much energy or as much stamina as most people do, and things take a lot more to do than most people. So you might have 4 spoons, but washing dishes, that's not just washing dishes. You're standing, you're moving your joints, you're stabilizing yourself, you're scrubbing possibly. There's your 5 spoons gone for the day.
No.
So very much take care of yourself. One other thing too with EDS is, as far as with providers and for patients themselves, we use a chronic pain scale, which is very different from the typical pain scale. Things that would, like a normal headache for somebody that would be irritating, they can function, but they're not, that's how my migraines are. I can work with a full-on migraine with, I actually have one today because it's raining and whatnot. I'm nauseous. I haven't been able to eat today. Noise sensitivity isn't bad today. Light sensitivity is. Know your body and get your providers to understand that your pain scale is different, because what most people can function on, and the points that they can't get to where they can't function, we're still functioning, and most of the time you can't tell that I'm in pain. You
Yeah.
won't see it until you check my blood pressure, and my blood pressure is 190 over 120 or something like that. So that's one other thing, especially with providers, that it's good to know, because a lot of times people are like, you're over exaggerating, and it's like,
Yeah.
no. No, we just live at a different pain level. I went to a convention 2 weeks ago, and I did face painting and glitter tattooing for any of the people that were there. I ended up having my pictures done professionally, which I've never actually have done. I was dead for a week. Like, I put all my stuff away, and like I live in a little tiny cottage, and stuff was just stacked for like a week because I had nothing left. I did a spider pose, and I dislocated my toe during it. And I know when I do things like that, I'm going to be tired, I'm going to be exhausted. And so I just try to pre-plan as best as I can. Okay, I know I'm going to need a week off after
Yeah.
doing this or whatever. So, you you got to be you got to live. You got
Yeah.
to live. Quality over quantity. I may not have a long lifespan, but I'm going to enjoy life. I'm going to
Yeah.
enjoy life and live life.